Hello everyone, welcome to the series of pharmacology. Here we are studying chapter number 11, General Pharmacology, in which 11.2 drugs acting on peripheral nervous system. 2 points are there: skeletal muscle relaxants and local anesthetics. The peripheral nervous system is important component of overall nervous system responsible for transmitting signals between central nervous system and various organs, muscles, tissue throughout the body. There are two main divisions of peripheral nervous system. They are autonomic nervous system and somatic nervous system. Autonomic nervous system controls involuntary functions such as heart rate, blood pressure, digestion, and respiratory rate. Somatic nervous system voluntary controls of skeletal muscle. Classes of drugs that act on nervous system. Neuromuscular blocking drugs. These drugs interfere with the transmission of nerve impulse to skeletal muscle. These drugs cause muscle paralysis by blocking nerve signal transmission at neuromuscular junction. These drugs are used during the surgical procedures to induce muscle relaxation, for example, succinylcholine, choline, and second, pancuronium. Adrenergic drugs. These drugs influence the sympathetic nervous system, which are subdivided into adrenergic agonist and adrenergic antagonist. For example, epinephrine. Cholinergic drugs. These influence the peripheral nervous system, in which two parts are there: cholinergic agonist and cholinergic antagonist. Cholinergic agonist stimulate the receptor, for example, acetylcholine, and cholinergic antagonist blocks the receptor, for example, atropine. Adrenergic blocking drugs agents. These drugs inhibit the effect of sympathetic nervous system used to treat the condition like hypertension and certain cardiovascular disorders. For example, alpha blockers, beta blockers, etc. Cholinergic blocking drugs. These drugs inhibit the effect of parasympathetic nervous system used in various medical situations including pre-anesthetic medications. For example, scopolamine and atropine. Skeletal muscle relaxants. These are the diverse class of drugs designed to alleviate the muscle spasm, stiffness, and associated pain. Skeletal muscle relaxant drugs are classified into different categories based on their mechanism of action and therapeutic effect. In that first one, neuromuscular blocking agents. These drugs act at a neuromuscular junction and block the transmission of nerve impulse to skeletal muscle. For example, succinylcholine. Point B. Centrally acting muscle relaxants. These drugs act on the central nervous system, specifically on the spinal cord or brain to reduce the muscle spasm. For example, baclofen in hiccups, baclofen to relax the muscles. Point C. Drugs acting muscle relaxants. These drugs have direct effect on skeletal muscle function and are often used to treat acute musculoskeletal conditions. For example, dantrolene. Point D. Antispasmodic agents. These drugs are often used to manage statistically spasticity associated with neurological conditions such as multiple sclerosis or spinal cord injuries, for example, baclofen. Peripherally acting muscle relaxants. These drugs may act at the neuromuscular junction or directly on the muscle fibers to induce relaxation. For example, botulinum toxin, which inhibit the release of acetylcholine at the neuromuscular junction, leading to the muscles paralysis. Autocoids are unrelated drugs. Non-steroidal anti-inflammatory, antipyretic analgesic drugs. Autocoids are biologically active substances similar to local hormone. These are produced in small quantities by cells acting locally near their sites of release and are rapidly metabolized. These autocoids influence the local cells and tissue, playing crucial role in procedures like inflammation, allergic reactions, and tissue repair. Classification autocoids amine-derived, lipid-derived, and peptide-derived. Amine-derived histamine and serotonin. Lipid-derived prostaglandin and leukotrienes, and peptide-derived bradykinin and angiotensin. Characteristics of autocoids: they act primarily on the tissue and cells where they are synthesized and released, unlike hormones which are synthesized and transported to distant site. Autocoids produced as needed rather than being stored in large quantities for later release. They have a short duration of acting, being quickly metabolized and inactivated at or near their site of synthesis. They modulate the function of nearby cells and tissues and are involved in a wide range of functions like inflammation, allergic reaction, tissue response to injury, microcirculation, mood regulation, appetite, blood clotting, etc. Autocoids are local hormones, means they act on same cell and tissues that produce them. In contrast, two hormones are produced by specialized endocrine cells and travel through blood stream to affect distant target organs. Now the main point: NSAID started. Non-steroidal anti-inflammatory drugs. These are the drugs that reduce inflammation, pain, and fever by inhibiting the synthesis of prostaglandin and related compounds. NSAIDs inhibit the cyclooxygenase, that is COX-1. Major actions of NSAIDs are analgesic, antipyretic, and anti-inflammatory. NSAIDs are used in post-operative pain, pyrexia, menstrual pain, myalgia, neuroglia, headache, backache, muscle pain, osteoarthritis, rheumatoid arthritis. Prostaglandin functions: cause pain, enhances pain-inducing effects of bradykinin, induces fever. Histamine functions: it causes the tissue congestion, swelling, bronchoconstriction. It also causes sneezing, watery eyes, itchy, and pain. Analgesic, antipyretic, anti-inflammatory action is due to the inhibition of inflammatory mediators, that is prostaglandin, histamines, thromboxanes, and leukotrienes. Classification of NSAIDs: non-selective COX-2 inhibitors, preferential COX-2 inhibitors, selective COX-2 COX-2 inhibitors. Non-selective COX-2 inhibitors are aspirin, ibuprofen, flurbiprofen, naproxen, mefenamic acid, piroxicam, ketorolac, indomethacin, phenylbutazone. COX-2 inhibitors are nimesulide, meloxicam, etodolac, diclofenac, aceclofenac. Selective COX-2 inhibitors are celecoxib, etoricoxib. Analgesic but poor anti-inflammatory are paracetamol or acetaminophen. Second, metamizole. Third, nefopam. Mechanism of NSAIDs. First, arachidoic acid release. The process begins with the release of arachidoic acid from phospholipid present in the cell membrane. Cyclooxygenated enzymes, COX enzymes. Arachidoic acid is then converted into prostaglandin X2. Though the series of enzyme reaction with the key enzyme decox enzyme. Prostaglandin synthesis, prostaglandin H2 synthesis, COX enzyme catalyze the conversion of arachidoic acid into prostaglandin H2. Prostaglandin H2 converted into different prostaglandin including prostaglandin E2, prostaglandin and prostacyclin and thromboxane A2. Inflammatory response. Prostaglandin, particularly plus prostaglandin E2, play a key role in mediating the inflammatory response. They contribute to vasodilation, increased vascular permeability, and sensation to pain receptors. Suppression of prostaglandin synthesis, anti-inflammatory effects, analgesic effects, antipyretic effects. NSAIDs work by inhibiting the activity of COX enzymes, particularly COX-2, which is included during the inflammation. Some NSAIDs also exhibit COX-2 varying extent. By inhibiting the COX enzyme, NSAIDs suppress the synthesis of prostaglandin. The reduction in the prostaglandin lead to anti-inflammatory effects manifested by decrease in the pain, swelling, redness at the site of inflammation. NSAIDs also provide the analgesic effect by reducing the sensation due to pain receptors due to decreased synthesis of prostaglandin. Prostaglandin, particularly prostaglandin E2, act on the hypothalamus to induce the fever. NSAIDs reduce the fever by inhibiting the synthesis of these fever-inducing prostaglandins. Antipyretics constitute the vital class of medication aimed to mitigating fever and associated symptoms. Fever, often a response of infection or inflammation, involves the elevation of body's normal temperature set point. Antipyretics such as anti-acetaminophen, acetaminophen, paracetamol and NSAIDs like isoprene exert their effect by modulating the activity of hypothalamus and central temperature regulating center in the brain. These drugs work by inhibiting the productivity of prostaglandins, which play a role in raising body's temperature at set points. Mechanism of action of antipyretics. Fever induction. Fever is often induced by body's response to infection, inflammation, or other medical conditions. Pyrogens are substances that trigger temperature, stimulate the release of prostaglandins, particularly prostaglandin E2 in hypothalamus. Prostaglandin and temperature regulation. Prostaglandin, specifically prostaglandin E2, plays a central role in the hypothalamus, which serve as body's temperature control center. Elevated prostaglandin levels lead to the increase in temperature set point, causing the body to conserve the heat and generate more heat through the processes like shivering. Inhibition and reduction in prostaglandin levels. Antipyretic drugs exert their effect by inhibiting the enzyme called as cyclooxygenase COX is involved in the synthesis of prostaglandin inducing prostaglandin E2. Acetaminophen primarily inhibits COX in central nervous system, particularly in hypothalamus. NSAIDs inhibit both peripheral and central COX enzymes. Lowering of temperature set points and heat dissipation. With reduced prostaglandin levels, the temperature set point in the hypothalamus is lowered. This leads to the decrease in body's perceived normal temperatures. As the temperature set point decreases, the bodies begin to dissipate heat more effectively. Heat loss mechanisms such as sweating and peripheral vasodilation are activated, in turn leads to normalization of body's temperature. Here completes our point number 11.2 and 11.3 from General Pharmacology. Stay tuned with the next lectures in the upcoming different series of different subjects. Thank you so much. If you want, you can write these notes and you can just take help of this audio clip for writing your notes. Thank you so much. Bye bye.